holidays might be easier.
And I will call this Tuesday, October 28th, 2025 Board of Moffett County Commissioners meeting to order. The chair will move to approve the agenda as presented.
Second.
Any comments? All in favor?
Aye.
Aye. And chair will move to approve the consent agenda, items A through I as presented. Okay. Any further comments? All in favor?
Aye.
Aye. All right. We'll move right into public comment. You know the drill. Come on up. Good morning.
Good morning, Commissioners. I'm Allison Anthony. We have some important information to bring for you this morning. This past week, John Case, the attorney for incarcerated former Mesa County Clerk and Recorder, Tina Peters, wrote an important letter to Governor Polis and Secretary of State Jenna Griswold regarding the electronic voting machines in Colorado. We will share with you the first part of Mr. Case's letter, which has been edited to save time. This is the letter from John Case. As counsel for Tina Peters, I call your attention to new evidence which demonstrates that the Dominion software used in 60 counties in Colorado is vulnerable to manipulation by foreign and domestic bad actors. The evidence below was revealed in the testimony of two former Venezuelan government officials, one of whom is a computer expert. The other witness served as security chief for former deceased dictator Hugo Chavez. According to the witnesses, Dominion used a modified version of Smartmatic software that was deployed to rig elections in Venezuela. Dominion retooled and rebranded its software to run on a Windows operating system, but bad actors can enter the voting system without detection, and they can exploit software vulnerabilities to control election outcomes. Smartmatic software originated in Venezuela in 2003 and the director of now deceased dictator Hugo Chavez. At the direction of now deceased dictator Hugo Chavez. It was a condition of the development contract that Smartmatic software would allow government-controlled engineers to inject votes during an election so that the government candidate would always win. The first witness, a Venezuelan computer expert, described how Smartmatic engineers Ronald Morales and David Moreno created the data utility tool that was used to inject these votes for government candidates during the elections. The second witness, Chavez's former chief of security, describing how during the 2013 presidential election, government officers commanded that Smartmatic engineers, using the data utility tool, inject over 2.2 million votes for Maduro into the election. So Maduro then had a lead of 200,000 votes and was declared the winner. Chavez used Smartmatic software to rig elections and elect communist leaders in other South American countries, including Bolivia, Argentina, Ecuador, and Colombia. Chavez bragged that one day Smartmatic would elect the President of the United States.
I'm Tracy Winder. I am a resident of Moffat County, and this is a continuation of the same letter. In 2005, Smartmatic purchased an American voting systems company, Sequoia, whose president at the time was Eric Coomer. Smartmatic transferred its software to Sequoia. In 2010, Dominion Voting Systems purchased Sequoia, thereby acquiring Smartmatic software and the capability to rig elections. Same people, same enterprise. Dominion currently employs Ronald Morales and David Moreno, the two Venezuelan engineers who created Smartmatic software with the capability to rig elections. False testimony. In January 2021, Dominion President John Polis testified under oath before the Michigan Senate that Dominion voting equipment cannot be connected to the internet. Mesa County voting system forensic images preserved by Tina Peters revealed 36 wireless modems with internet connectivity. The Venezuelan computer expert who reviewed the Mesa County forensic images testified that Chinese firmware could allow an undetectable internet connection to the modem even when software shows that the modem is turned off. Components for Dominion voting machines are manufactured in China, an enemy of the United States. The components are assembled into computers in China, Taiwan, and Mexico. The computers are configured in a Texas warehouse by David Moreno, one of the engineers who developed Smartmatic election rigging software. Experts have testified that Dominion systems are designed so that fraud cannot be detected. Log files are intentionally undersized, which results in overwriting log files generated during an election, so the election cannot be audited. Man-in-the-middle software allows remote entry into the voting system without detection. Indictments. On October 17th, 2025, the U.S. Department of Justice released superseding indictment of Smartmatic and 3 of its executives for allegedly paying over $1 million in bribes to induce a Philippine government official to hire Smartmatic to run the 2016 Philippine elections. Constitutional violations. Article 4, Section 4 of the U.S. Constitution guarantees every state a Republican form of government in which citizens, not computers, choose representatives to govern them. Article 2, Section 5 of the Colorado Constitution guarantees that all state elections shall be free and open. Because bad actors can manipulate Colorado elections, our constitutional rights to free elections are being violated. We have one more.
Yeah, thank you.
Good morning. My name is John Williams. Been a resident of Moffett County for 57 years. This is a continuation of the letter. The sale of Dominion, and rebranding after the testimony of 2 Venezuelan witnesses became public knowledge. Dominion announced that the company has been sold and the company name changed to Liberty Vote. Rebranding the unsafe voting system fails to protect the citizens of Colorado from election fraud. Interesting timeline. September 23rd, 25, testimony of Venezuelan computer expert filed and viewed by public on the internet. October 1st, 2025, testimony of Hugo Chavez's former chief of security and viewed by public on the internet. October 9th, suddenly Dominion sold and rebranded as Liberty Vote. As a Colorado lawyer, I believe the following immediate actions are necessary to assure free and transparent elections in Colorado. Eliminate the use of computer voting machines in all elections. Return to vote in person with government-issued ID on election day in the voter's own precinct on paper ballots that are hand-counted in the precinct by bipartisan election judges under public observation. Hand counting ballots work successfully in most industrialized nations. Hand counts worked in Colorado for 100 years before we outsourced our elections to private vendors. Preserve all existing election records, including digital logs, databases, and forensic images for use in future audits and civil rights litigation as required by U.S. Code. Convene public hearings to examine the evidence presented by experts and whistleblowers. Failure to act now will erode public trust in the voting system beyond repair. Respectively, John Case, PC. Commissioners, experts agree that there are no safe electronic voting systems available anywhere. Yet our state legislature passes laws attempting to force us to use these sketchy machines. No government has the authority to ask voters to forfeit their right to free and fair elections. If the current county contract with the Dominion voting system is like the last contract, Moffett County can terminate that contract by declining to appropriate Dominion funds for future year. Please consider doing that for 2026. Each of us must do our part to secure our elections. And I will point out again the 2 things that are obvious here. Tina Peters was persecuted, not prosecuted. The intent was to the other 60-some clerks, shut up, sit down, or you will be next. And why would we turn over all of our most important election stuff to Chinese-made companies? Parts and stuff made in China. It makes no sense. Thank you.
Thank you. Anyone else for public comment? Any general discussion? Morning.
Good morning, Louis Wymore, Moffett County resident for almost 50 years. I wanted to testify on the other side of voting. As an experienced election judge, which I haven't been since 20, I never seen anything that even smacked of any kind of fraud. We have a very efficient voting system in Colorado. I love the mail part. You get it in the mail, you have time to digest it. I don't see where that is. And if we're really concerned about computer fraud, we probably need to push Congress into putting limits on things like internet exposure and AI. But I appreciate the state is going in the direction that they are with mail-in vote voting. Thank you.
Thank you.
Thank you. Anyone else? Okay. And there was no general discussion? All right, we'll move on to staff reports. Office of Development Services, Neil Binder.
Morning, Commissioners.
Morning.
All right, so we're gonna kind of go out of order just because of how it needs to be kind of presented. So let's move to 102. This is all three resolutions, and do we want to vote all at the end or individually? How do you want to go about that?
I'll be abstaining, so we'll
Probably
ask
should
the
do-
chair, the vice.
At a time?
We're done what wants to do.
One at a time. Yes,
Yes, that'll work.
okay, one at
One
a
at a
time.
time. Okay, so Resolution 2025-102 is a resolution authorizing negotiations for purchase of real property for the use of Moffett County. This is specifically in regards to the property that is down at the fairgrounds. We surround it on three sides. The site is also known as Northwest Diesel at this point. And so this is authorizing those negotiations for the purchase of that piece of property. And we feel that it complements the fairgrounds because it is surrounded by the fairgrounds as it sits. So any questions about that? One thing I will note as well is we have attempted to purchase this piece of property 2 other times. So it has been in the county's interest for some time.
That's what I said. Yeah, that I would be turning it over to the chair, vice chair. For this portion.
So you're out of the discussion. and
I'm
everything.
turning the meeting over to you for this portion.
That's what I was asking, yeah.
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 So she can run it, she just can't vote.
I think if she's abstaining from the whole thing
Oh, the
because
whole
of
thing.
lack of,
Okay.
conflict of interest, I think that she should not run that portion of the meeting, but
That's what I would think.
that was the only thing I was
Max will-
concerned about.
Max will join us.
Honestly, I think you could probably do it either way. If you wanted to turn it over to the vice chair, just so that you completely abstain. The one thing I would say is to just clearly put on the record that you're abstaining. And just make that really clear before we go forward.
Yeah, so that's what I would prefer to do is turn it over to the vice chair to run this staff report. And I will abstain from all actions.
Okay.
I'm up this morning.
Yeah, it woke me up this morning. Yeah, I guess we're going off of this, what's the,
Mr. Vice Chair, I will move that we approve 2025-102 resolution authorizing negotiations for the purchase of real estate or real property for the use of Moffett County.
second? Favor?
Aye.
Abstain.
All right, let's move on to 103. Resolution 2025-103 is the resolution for authorizing usage of capital reserves to purchase this real property that we're talking about. The fund that we are using is some mineral funds that were set up back in 2006 for instances specifically to this type of transactions. We've held on to that money and it is still growing. It's oil and gas funds that the county has been accruing since that date. Yeah, this is a great opportunity to utilize those funds. So there's over $1 million in that fund at this point, so there's sufficient funds. We don't have to use multiple funds by any means.
Yeah, I think it's important that we're buying something that's going to make what we have better. It's not like we're just getting into real estate property, right?
Correct.
Somewhere that doesn't make any sense. This is going to complete this rectangle or whatever you want to call that at the fairgrounds instead of having private property in the middle of it, right? And so I think it's important to know. Mr. Vice Chair, I'll make a motion to approve 2025-103, resolution authorizing usage of capital reserves to purchase real property.
Second. All in favor?
Aye.
Aye.
Again, abstain.
All right, now we'll work back to 101. Resolution 2025-101 is a resolution for an authorization for Commissioner Broom of Board of County Commissioners, Moffett County, to sign the documents for the purchase of stated piece of property, block 14 and 15 of East Craig Town Site here in Craig, Colorado. So just finalizing all the documents, setting forth that Donald will be lead on signing all the documents for the purchase.
Good. Mr. Vice Chair, I'll make a motion to approve 2025-101, authorizing for Commissioner Broom of the Moffett County Board of County Commissioners to sign documents for the purchase of block 14-15 of East Craig Town Site, Craig, Colorado.
Second. All in favor?
Aye.
Aye.
And again, abstaining.
Thanks, Commissioners.
Okay, thank you.
Thanks, Neil and Roy, for working on this.
Yeah. Thanks.
All right. I'll now take the meeting back over and we'll go to Human Resources Department, Rachel Bauer. Morning.
Stuff together here. All right, so today I'm here to request the board's approval to move forward with the 2026 proposed health benefits plan for Moffett County. That includes a tiered health benefit option that was proposed by Memorial Regional Health earlier this year. Over the last few months, we have worked with our health insurance broker to review the most cost-effective option for Moffett County that will help maintain lower employee contributions, as well as making sure our health and benefits stay sustainable for Moffett County and our employees as we move forward into 2026. So a quick overview of our current health plan. We have been with Personify Health and 6 Degrees since January of 2020, so quite a few years. It is a non-traditional plan, so it's not like your traditional plans where you have your in-network providers. This plan works as far as our employees can go in or they can see any provider since there is no network essentially. So it is a little bit different and they have the reference-based pricing as well where they come in and negotiate the rates as far as running comparisons with other providers to try to get the most cost-effective pricing, essentially. At the beginning of this year, we set up a contract with Memorial Regional Health. That way we could make sure that our employees had cost-effective coverage with Memorial Regional. That contract was set up as 65% of billed charges, which most of your traditional plans do 80% billed charges. So that was a really good rate that they negotiated with us. This current contract that we're in for 2025 will expire at the end of December. The other coverage that we're pretty proud about, I think we can all say, is we offer our employees a free employee clinic. That is currently with UC Health. Right now, all full-time employees with their dependents, regardless if they're on our insurance plan, can be seen at the clinic. All of our part-time employees can also be seen at the clinic, but not their dependents. So we do extenuate that out to our employees currently there.
So
Yeah, go ahead.
if I'm on that, somebody came to me yesterday and asked me
Yeah.
this, and
Sure.
so if my wife's not on my insurance,
Mhm.
she can still go to the clinic.
Absolutely.
That's what I
Yep.
thought.
Yep.
There's a
Definitely.
misunderstanding with some employees.
Yeah, I think there has been, but the last couple of years, that's how it's been set up as
That's
far
right.
as, definitely. Yeah, you're welcome. And with the clinic, we currently have a contract. We've had a contract in place for the last couple of years with UC Health, and we are not making any changes to that as we move forward into 2026. So this year, our office did get with our broker earlier in the spring to request them to run renewal comparisons. We asked them to run those through our current coverage plan, UMR, and Cigna Insurance. Also with those quotes, we asked them to keep all three of those quotes the same as what we currently have for coverage. And then we also asked them to encompass the proposal that MRH brought forward as far as the tiered benefit plan option. So honestly, through all of that review, all the quotes provided, Personify Health and 6 Degrees came out to be the best option for us. And then also with moving forward with the tiered benefit plan model with MRH, because they are able to offer a 65%, or they did agree to offer a 65% of billed charges. Initially, it was at 70%, but they definitely worked with us to get that lower to 65%. So the other quotes with UMR and Cigna were way too much, not something that the county can move forward with at this time. Right now, Personify Health and 6 Degrees is looking like it's the best option for us as we move forward. So if you go to Exhibit A, this is going to be our 2026 proposed medical plan, included with the MRH tiered benefit plan option. So as you can see, tier 1, just to kind of give you an overview, that would be all services performed at MRH will apply to tier 1 level of benefits with a lower deductible, lower out-of-pocket maximum, and copays and higher coinsurance, which will result in a lower out-of-pocket cost for our employees. So tier 1, right now for individual, they have it set up as far as the proposal, $750 for an individual and $2,250 for a family. That's currently the coverage that we have for our 2025 plan, essentially for tier 1. As far as the coinsurance, what our employees would pay is 10%. So that lowered quite a bit compared to where we're at right now. So the plan pays 90%. The employee will pay 10% under tier 1. And then they did work with us. Yeah.
Had a mistake there, though.
So
Co-insurance on the other side, it shouldn't be 75%.
it'd be 25%. That's what it'll show. So when they send us these, they usually, which we've asked them for purposes of our benefit booklet, to put what the employee's going to pay. So that will say calendar out of pocket includes or co-insurance you pay after deductible. That will be in there for the employee. So that will be 10% for the tier 1, 25% for the tier 2.
I just thought.
Yeah.
That page
You're
right
good.
there doesn't
Shows
match
it.
that.
Well, when they usually put it in, they'll put what the plan pays, but you are correct. it's going to be 25%. Yes,
Alright.
absolutely. That's just what they sent for, because we've gone back and forth with some proposals on there too. But when in the benefit booklet, it will state what the employee pays, so there's no confusions there, and it makes it easier.
You.
Um,
That's what, yeah.
And I know there's quite a bit of stuff, so if you guys have any questions, just let me know. Primary care physician office visit with MRH will be zero copay, so that's a really great feature for our employees. Under tier 2, that's going to be $20 copay. We will still have our coverages that we asked for, as far as in 2025, most of those will remain the same. As far as the chiropractor visits, we increased the orthodontia to 2,500. So we made quite a bit of great benefit changes for 2025. So those were also included with these proposals, just so you guys know. So you can see as far as the tier 1 structure is going to be more cost effective for our employees. Essentially tier 2, if employees decide so as far as for services in tier 1, you, to get those discounts as far as with the lower deductibles, you would need to go to the tier 1 essentially. And then tier 2 would be outside of Memorial Regional Health. So how it's going to work for tier 2 is, since our current plan with Personify Health does not have an in-network or out-of-network, essentially our employees, if they want to see a different specialist, they have that opportunity to see someone else if they like, or a different provider. Or if it's a service that MRH does not offer, then that falls under tier 2, but employees can still go see another provider if they don't offer that. Tier 2 will work essentially the same as it has been for our current plan, with a reference-based pricing, with the exception that the deductibles are going to be increased under the tier 2 structure. So to give you an example, for tier 2, for an individual, that's a $1,500 deductible. Family is $3,000, which we've had that in the past for the $3,000. $1,500 is a little bit more, but with MRH, it's going to be about $750. One great thing about this structure is the deductibles. There will be a cross accumulation feature. So if you go to tier 1 or tier 2, those amounts will apply to both deductibles. So your out-of-pocket maximum, those will be applied. So it's not that you have to meet your deductibles in tier 1 and tier 2. Those essentially cross accumulate amongst each other. So that's a great feature there. And then one thing kind of going back, I did ask our insurance provider to run some numbers. So based on the analytics, currently we have estimated about 3 million claim exposure, right? As far as what they came back, half of our claims exposure is through MRH. So that makes up for 1.5 million. Those are numbers that I was able to get from 6 Degrees. So I just wanted to share that with you guys there. And then if you guys, do you have any questions on the tiers, on the structure here? Okay.
I think one thing we should do though,
Yeah.
maybe in the next week or this week, is make sure that we send out a very detailed understanding to all our employees, letting them have the opportunity to come and talk to one of the commissioners, to you, so they can explain. There's just lots of questions and
Absolutely.
try to answer as many as we could. I know Donald has been cornered. I've been cornered. I'm sure Mel has.
Yeah.
And so just want to make sure that, and it's just all it's change, right? So we hate change and
Yeah, and absolutely. We've talked to a couple of people this week. I mostly via email. I've received some emails, but we're happy. Our office is always happy to answer any questions. If anybody absolutely wants to come talk to us, this is going to be new for us too. So we will, as the best that we can, essentially, we will answer those questions.
for sure.
And then,
We just send out an email though,
Yep,
explaining
so-
everything would be great.
yep, as far as, because we do have our open enrollment coming up here right around the corner, we will be sending out all that information too. So,
Thank you.
yeah, you're welcome. And then the RX benefits, that is currently who we have had through Personify Health and 6 Degrees. That's going to stay the same. So the deductibles on there will not change. As far as for like your generic, that's a $30 copay. Brand name is $80, and They do have, I believe their specialty might be like the 140 copay on there too. So those are gonna stay the same there too. So the next exhibit, which would be Exhibit B, for all the services that Memorial Regional Health provides, I did include those. So they have quite a bit of services. They have, I mean, it can range from behavioral health, cardiology, nutrition services, dermatology, general surgery, ortho. They have pain management, quite a bit, as you can see on this exhibit. And like it was explained, if MRH does not have these, if there's a service that's not included on here and doesn't fall in that tier 1, it goes to tier 2, essentially there. And the other thing that we've had discussions with MRH for our office is, and this could be later on in the plan year, we have visited with them about possibly setting up some discounts for nutrition services for our employees, if that's something that we can do as we move forward into 2026. And then also possibly putting on like a overall health clinic for our employees, like for afternoon or day. That is something that we visited with Memorial Regional Health. So nothing set in stone, but those are things that we would like to look at for 2026 to offer for our employees too. And again, those are things that we have to review with MRH as well. We would propose to have a 1-year contract term, just how we have it set up with Memorial Regional Health, and through Personify Health and 6 Degrees, we currently do annual contracts with them right now. So that would stay the same as well on there. And do you guys have any questions on the services? Okay. So next, if you want to go to Exhibit C, I don't know. Yeah, that's perfect. Yeah, sorry, I didn't label that one. So on Exhibit C, it has our current cost server plan and then what our 2026 renewal will be with Personify Health. So you can see on total projected for our current plan, our cost is about 4.2 million. For our renewal with when the Voya is our stop loss carrier too, that is going to be about 4.6 million that they're estimating for us for cost for 2026. So right below that, you can see that's about a 469,734 difference compared to our current plan. Right now, this year we've budgeted for $4,496,335. Then for 2026, that is our current budget right now, so they just moved that over. Our broker is recommending that we increase our budget by 4% overall based on these numbers. So what would be recommended is we increase our budget by 180,000 essentially to cover those costs to the increase. With discussion with our broker, this is actually probably one of the lowest increases that they've seen. They said with some of their other companies, they've had a 10% increase overall for their renewal. So with how we have the proposed setup, I do believe it's going to be pretty beneficial for us there too.
Yeah, you got plenty of time to do that before the final reading of the budget.
Yep, absolutely. And then it is a change that we're going to be making this year for employee contributions. So under Exhibit D, I have our current what employees pay monthly for 2025. So you can see for single, that's $14 monthly. Single plus dependent, that's $34. For a family, it's $44.50. And then for dental, $6 for single, and then $11.50 for employee plus dependent and family. So for
That's what we
20,
currently are doing.
yep, that's where we're currently at. So for 2026, we have increased. So for single, we're looking at a $6 increase. So for monthly, for benefits, which includes vision, you're looking at $20 a month. Single plus dependent, that's $40. Family, that's $50. And then down below, Dental is increasing for a single employee at $10 per month and single plus family at $15 a month. So, and we haven't, so looking at our coverages over the last few years, and we've been with Personify Health, we have not changed those employee contributions. So that just helps us to be able to, again, sustain our budget as we move forward into 2026 as well. And we try to keep those as low as possible that we could for our employees too.
And our brokers wanted us to go up way more.
Yep,
They were
definitely,
saying,
yeah.
Your employees don't pay anything compared to any of
Right.
the other companies we do.
Yeah,
And we try to say, well, this is kind of the way that we give, we don't pay a great pay like what some other companies do. This is kind of one of those benefits that we are able to, or try to give
Definitely.
as a bonus type of thing, right? So
yeah, we're definitely benefit strong there. And again, if any employees have any questions on these items, we're happy to go over those anytime. And then I guess, overall, I would like to request the board's approval to move forward with making a motion to approve our 2026 health benefit plan with a proposed MRH benefit option plan tiered structure. And then also if there's any contracts, I would like to receive approval to put those on, our consent agenda. I don't know if we'll get one. It is effective January 1st as far as the coverage. So it could be that I would put it on the appropriate consent agenda too. So do you guys have any questions or anything?
Thanks for the coverage and thanks for doing the analytics too,
Mhm.
showing where those claims are right now.
Definitely, yep. It was good to see the numbers and, yeah.
I will entertain a motion.
Okay. I make a motion to give approval to, Human Resources Department, Rachel Bauer, to move forward with the 2026 proposed health benefits plan for Moffett County that includes a tiered health benefit option that was proposed by Memorial Regional Health.
second,
Motion is second. Any further discussion? Hearing none, all in favor? Aye.
Aye.
Motion carries. Thank you.
Perfect. Thank you, guys.
All right. And now we have Stephanie Einfeld with Northwest Colorado Health. Good morning.
That was.
Yeah.
Can we wait for?
No, he had to leave.
Oh, okay. All right. Well, I will get started. Is this?
It should be on. You
Hold
can
on.
pull it forward if it's on.
Perfect.
There you go. Good morning.
Good morning. Thank you for having me. I'm obviously coming to present on the request that we sent you all probably 2 months ago now. A lot of this is going to be repeat from our work session, but I think it's important to reiterate it and talk through it again. I'll answer any questions that you have and just stop me if you have questions on anything. So I'm here to talk about a recent campaign that we launched for our home health and hospice services that we have provided in Moffett County since the 60s. We are basically launching a campaign for the next 3 years to promote sustainability of the programs. And so I did just want to talk about the impact that it has in Moffett County and talk through just the ask. So in Moffett, actually these say Craig, but this is actually the Moffett numbers. 45% of our home health and hospice patients reside in Moffett County, 40% in Craig, and then 5% in the outskirts of Craig and Moffett. And the majority of those patients are on Medicare, Medicaid, or our charity care program. Throughout the entire, we also provide the services en route throughout the entire program. We provide about 10,000 in-home visits. Our staff drive about 100,000 miles a year to do this, and we serve all ages, birth to death. the majority of which are 65 and older. Are you on it? Yeah, thank you. So the impact is substantial when you receive home health and hospice services. So, home health and hospice, obviously we are providing care in the home to people who are homebound for the home care program. What we're also doing when we're, besides the PT, OT, the very skilled services that we provide, we also do mental health screenings every time we're in the home for people. We are screening them for any other social services and connecting them to what they need. And again, this is homebound patients, so it's really, sometimes it's the only connection they have. And so think about it as about 4,500 well checks a year in your county outside of the actual medical services that they're receiving. You know, beyond that, it really allows a lot of people here to stay in their homes. If home health is not here, then a lot of people are more unsafe in their homes. They may deteriorate at a faster rate, and they may not be able to stay here and have to leave the valley or move in with a family member. And then that is a huge burden on that person who has to take care of them. Just to frame where we are in Colorado. Oh, we're on different pages. Oh, yeah. We talked about our risks as an organization and running this program the last time we met, but basically we are in a pretty hard reimbursement landscape in healthcare in general, and it's no different in home health and hospice. If you want to go to the next slide. Specifically, home services is basically a broken system, and it has been for a while. We annually are basically budgeting a loss of $900,000 next year without any community support or this campaign. The way the dollars work is that the services we provide cost about $6,000 per person. We get reimbursed about $2,500 to $3,000, and then when you multiply that by the people we serve, that's about $900,000 of unreimbursed care that we can no longer sustain at a point when all of our services are also taking cuts. And so that's why we're launching the campaign. If you want to go to the next slide. Thanks. Other communities in Colorado, there are a lot of frontier and rural communities that simply go without home health, or they have programs that are for private pay people only, or people with insurance. So it leaves out, most other programs leave out that portion of people who are on Medicaid or Medicare or uninsured, and ours doesn't. That's the difference. In the rural frontier areas, there's only 8 standalone nonprofit organizations that have either home health or hospice, and we are the only ones that have a charity care program along with that. So if you want to go to the next slide. So that is why we're launching the campaign. We absolutely need a greater level of community support to basically sustain us for 3 years. So we're raising $3 million over 3 years to keep home health and hospice services in the Valley. What we'll do during these 3 years is, one, we're gonna really double down and focus on some bigger event that nets a lot of dollars, similar to the Boys and Girls Club, hopefully, that can help sustain our gap. We're also going to continue to advocate for better payment models on the national and state level. I mean, it's something that we do continuously. I'm on the state board of Home Health, Colorado Home Care Association. And we are continually advocating for changes in landscapes, but that's advocacy. It doesn't always translate into change, right? But we'll continue to do that. We'll also continue to pursue creative partnerships and everything else that we need to do to maintain these services. But that 3 years will provide us a glide path. And then in the meantime, it'll also provide Moffat County residents 13,500 more visits over those 3 years, which is substantial. It really does help people maintain in their homes. Part of like the framework of our valley right now is that obviously we also have Casey's Pond, we have the Haven, we have Sandrock. I can't speak to where Sandrock is as far as capacity. The Haven is full with a wait list. Casey's Pond is completely full with a wait list. So when those types of entities are full and somebody is homebound and needs care in their home, if we're not here to do it, that means those people need to transition basically outside the valley because there is no other alternative for them or into a family member's home, which again is not ideal for anybody if you've ever been in that situation. So anyway, that the summary is just kind of like putting the stamp on the fact that we really need community support, and just wanted to give you a little more framework for the ask that I sent you all. I think when it comes to government support, and other partnership support, we've made asks to Memorial Regional Health, UC Health. You can see the list. Memorial Regional Health supported us last year to the tune of $100,000 and this year, and they're committed to next year as well, which I think speaks volumes to both the partnership that we have developed over the last several years and also their how important they see the services. I mean, they used to do it and they're like, we do not want to do it again. We lost a ton of money. And they're willing to support the program, which I think is huge. The city of Craig and the city of Steamboat, we are penciled into their budgets at this point, which is great. And, TBD on both counties actually. So just wanted to give you an update. The other thing that's happened since I sent you the request is that we did have a donor come forward and offer a $100,000 matching grant to get the campaign started, and we're about 50%. We've raised about $50,000 toward that matching grant, which is great. When we have partners like this support us, it really speaks to donors too. So it not only helps us from a funding standpoint, it also helps us from being able to go out and say, Moffat County supports this. This is really important to them. It brings more people to the table for us to be able to support long-term. So let me know if you have any questions.
No questions from me.
No, I don't.
Okay. Great. Well, thank you. I appreciate you listening and letting me expand on the ask.
Yeah.
Thank you.
Yeah.
And keep us posted when you get your plans for your fundraising stuff.
Oh, absolutely. I will. Thank you.
Thank you. Cool. All right. I would just make one last note. We will be closed November 11th for Veterans Day. So our next meeting will be on Wednesday, November 12th at 8:30 right here. And we're adjourned.